Sun or supplements? The truth about vitamin D. Hello and welcome to Better Health with Dr. Russell. Today we're answering a big question. Is it better to get your vitamin D from supplements or naturally from the sun? Let's break down the science, pros, cons, and what's best for your body. First, why vitamin D matters. Vitamin D is more than just a bone vitamin. It plays a critical role in immune health, mental well-being, cardiovascular function, and inflammation regulation. Deficiency has been linked to depression, increased risk of respiratory infections, osteoporosis, and even certain cancers. Yet about 42% of US adults are deficient in vitamin D. First of all, vitamin D is not naturally found in food sources in large amounts, so it has to be fortified. Also, research shows that being overweight and having a BMI over 30, which is 42% of US adults, leads to vitamin D deficiency. Being overweight is a prime driver of most chronic illnesses. So how do we fix that? Supplements or sunshine? First of all, losing some weight would help. Vitamin D is fat soluble, so it gets locked in the body fat and becomes unavailable when needed. Besides obesity, what else leads to vitamin D deficiency? Chronic health conditions like liver and kidney disease are a factor. Of course, so are gut issues like Crohn's and IBS. They lead to poor metabolizing and absorption. And then there are medications being a big cause of vitamin D deficiency, such as corticosteroids like prednisone, interfere with vitamin D metabolism, and calcium absorption. Long-term use can significantly reduce bone density and vitamin D levels. Anticonvulsants like phenytoin and phenobarbital induce liver enzymes that accelerate the breakdown of vitamin D into its inactive forms. Weight loss drugs like orlistat or Ali reduce fat absorption, thereby also reducing fat-soluble vitamin D absorption. Cholestyramine and cholestyramine, which are bile acid sequestrants, are used to lower cholesterol but bind fat and fat-soluble vitamins, which reduces vitamin D absorption. Antifungal drugs like ketoconazole inhibit enzymes involved in vitamin D metabolism. And then, the all-too-common antacid drugs or H2 blockers and proton pump inhibitors like omeprazole and ranitidine. They reduce stomach acid, impairing calcium absorption, which is closely linked to vitamin D activity. And don't forget that there are also some foods that interfere with vitamin D production. For example, highly processed foods may contribute to inflammation and gut issues that interfere with fat-soluble vitamin absorption. Alcohol, especially chronic use, affects liver function and may reduce vitamin D conversion to its active form. High-sugar diets are linked to obesity and insulin resistance, which are both associated with lower vitamin D levels. Trans fats interfere with fat digestion and absorption, potentially impacting vitamin D uptake. Excess calcium can also interfere. Calcium and vitamin D go hand in hand and share a feedback loop. If calcium levels are too high, the body shuts down vitamin D absorption. The opposite is also true. With all these causes of vitamin D deficiency, it's no wonder that 42% of adults are low in vitamin D. So how do we correct it? First, try to correct some of the things mentioned earlier in this video. Then you have two choices. Get your vitamin D either from the sun or from supplements. Remember that vitamin D is not found in foods naturally, it has to be added. Let's start with sunshine. What are its benefits? Our skin produces vitamin D3 or cholecalciferol when exposed to UVB rays from sunlight. Just 10-30 minutes of midday sun exposure on the arms and legs a few times a week can produce enough vitamin D, depending on your skin tone, age, and location. It doesn't take much. You don't need to be in a bathing suit. Sun on your arms and legs is sufficient. Our early ancestors got plenty of sunshine, so our vitamin D system was passed down from them. Here are the benefits of using the sun. First, it's free and natural. Sunshine on the body is self-regulating, meaning your body won't overproduce vitamin D. The conversion shuts down once enough vitamin D is made with each exposure to sunlight. And my favorite thing is that sun exposure may also boost your mood and circadian rhythms, and is good for the cardiovascular system. What are the negative of the sun? Overexposure to the UV from the sun increases the risk of skin cancer. Don't overdo it, you don't need much. Seasonal limitations. In northern climates or winter months, you might not make any vitamin D at all. Plus, using sunscreen blocks UVB, reducing vitamin D synthesis by over 90%. Now let's talk supplements. What are the advantages of supplementation? Vitamin D3 supplements, usually extracted from lanolin from sheep's wool or lichen, are easily absorbed and widely available. Plus, they are inexpensive. Studies show that daily doses of 1,000 to 2,000 IU are effective in maintaining adequate levels in most adults. The safe upper limit for most people is 10,000 IU per day for long-term. Supplements are safe, easy, and reliable. No UV exposure. Ideal for dark-skinned individuals, older adults, or people with limited sun exposure. The cons of supplements? There is the slight risk of overdose if taken in excess, usually above 10,000 IU per day for long-term usage. They lack the additional benefits of sunlight like nitric oxide production and circadian regulation. Bioavailability of supplements varies depending on your gut health and fat absorption. Besides obesity, poor gut health is a big issue for many people. Check out our videos on gut health. But what does the research say about the sun versus supplementation? A 2022 review in the Journal of Clinical Endocrinology and Metabolism found that while sun exposure and supplements both raise blood levels of 25 OHD, the active form supplements are more reliable in maintaining consistent blood levels of vitamin D. But sunlight offers broader biological benefits, including possible mood enhancement and cardiovascular protection not offered by supplements. This is an important fact. So here's the balance. If you live in a sunny climate and can safely spend time outdoors, sun exposure is a great option. But if you're in a high-latitude region, have darker skin, or avoid the sun for health reasons, supplements are a must. So, what's better, sun or supplements? Great question. Ideally, both, in moderation. Get safe sun exposure when you can, and add supplements on days you don't go out in the sun. That's what I do. Just 15 minutes of sun to elevate the mood, and then some vitamin D gel capsules for added insurance. Thanks for watching my video. Let me know in the comments. How do you get your vitamin D? Don't forget to like and subscribe for more natural health tips. And remember our health motto, to be healthy we must think well, eat well, and move well. So, until next time, stay healthy and stay curious. Take care.